All right, welcome to The Explainer. Today we're going to talk about that shaky, anxious, hangry feeling so many of us know as a sugar crash. But as you're about to see, there's a whole lot more going on under the hood. You know that feeling, right? You feel weak, maybe a little dizzy, and you have this sudden, overwhelming need to eat something, anything, right now. But what is your body actually trying to tell you?
Well, what you're feeling is a condition called hypoglycemia. That's just the medical term for low blood sugar. And while we often connect it to diabetes, sometimes its causes can be a total medical mystery, turning your body's internal fuel gauge into a really serious puzzle.
Okay, so what does low blood sugar actually feel like?
Well, your body doesn't just send one little signal. It actually sends out two very different sets of alarms to get your attention, and they kick in at different levels of danger. Think of it this way. Your body's response happens in two stages. First step, you get these autonomic symptoms. That's your nervous system just, kicking into high gear. It's releasing hormones like epinephrine to basically scream, hey, we need fuel and we need it now. But if that doesn't fix the problem, you get what are called neuroglycopenic symptoms. And this is when the brain itself isn't getting enough glucose, which, you can imagine, is way more serious.
So those first alarm bells, the sweating, that sudden anxiety, the shakes, they usually start to ring when your glucose drops to around 60 milligrams per deciliter. This is your body's early warning system.
But, and this is where things get really critical, if your levels keep falling down to around 50 milligrams per deciliter, that's when the brain's function starts to be directly affected. And that's when you start seeing things like confusion, blurred vision, and in the worst cases, even seizures. It's a dangerous drop.
Now, for the vast majority of people who deal with this, the story of hypoglycemia is actually tied to managing another condition, diabetes. You see, for folks taking insulin or certain other oral medications, hypoglycemia isn't really a separate disease. It's a side effect of their treatment. It's this constant, delicate balancing act between their medicine, the food they eat, and how active they are.
And because it's such a common issue in this context, doctors have a very clear line in the sand. For these patients, a glucose level of 70 milligrams per deciliter or less is officially considered hypoglycemia and means it's time to take action, even if they're not feeling symptoms just yet. And this really gets at why it's so rare for people without diabetes to get these symptoms. Your body has these amazing, powerful backup systems. When glucose starts to dip, it releases hormones like glucagon and epinephrine to pull it right back up. In a healthy person, this system just works.
But what if someone doesn't have diabetes and they keep getting these symptoms? Well, then it stops being a simple side effect and it turns into a full-blown medical detective story that requires a very specific set of clues to solve. To crack the case, doctors pull out a classic tool from their diagnostic toolkit. It's been used for decades and it's called Whipple's Triad. It's a simple but incredibly powerful three-point checklist to prove that the symptoms are really being caused by low blood sugar. Think of it like a three-part checklist. It's super logical. First, is the patient actually having the symptoms we just talked about? Second, and this is the big one, did we get a blood test while they were feeling that way? And does it show a glucose level below 55? And third, do they feel better as soon as you give them some sugar? You gotta have all three for it to count. Case closed.
And if things are still a mystery even after that, doctors might bring out the big guns, a supervised fast in a hospital that can last up to 72 hours. It's the ultimate test, really, to see if the body can maintain its blood sugar on its own or if something is driving it down.
Okay, so let's say Whipple's Triad is confirmed in someone without diabetes. What on earth could be causing it? Well, the list of potential suspects is surprisingly broad, and doctors often start narrowing it down based on whether the person seems healthy or is already quite sick.
So if you look at someone who seems perfectly healthy, doctors might start thinking about really rare things, like a specific kind of tumor or maybe an autoimmune problem. But on the other hand, if the person is already critically ill, the cause is probably linked to what's already going on. Major organ failure, a bad infection like sepsis, or even just severe malnutrition.
One of the most classic mystery culprits on that list for a healthy-appearing person is something called an insulinoma. It's this tiny, rare tumor on the pancreas that just goes rogue and keeps pumping out insulin no matter what, driving blood sugar down, especially when someone hasn't eaten for a while. All right, so let's talk treatment. How do you actually fix this once you know it's happening? The approach is really different depending on if it's a mild dip you can handle yourself or if it's a true medical emergency.
For those moments when you can treat it yourself, there's a simple little rule to burn into your memory. The rule of 15s. It goes like this. You take 15 grams of fast-acting carbs. Think half a glass of juice or a few glucose tablets. Then you wait 15 minutes. After that, you check your blood sugar. If it's still low, you just do it all over again. Simple and effective.
And this right here really shows you the different levels of care. If a person is awake and can swallow, simple sugars are perfect. But if they're confused or worse, unconscious, you can't have them drink anything. That is an emergency, and it calls for either a glucagon shot that can be given at home, or if they're in the hospital, intravenous dextrose.
But we have to remember, right? The juice, the glucose tablets, that's all just a temporary fix. It's a Band-Aid. The real solution, the long-term fix, is always going back and treating whatever the underlying cause was that we found in our detective work, whether that means surgery to remove a tumor or just adjusting some medications. So when you really dig into all this, what does it tell us? It shows us just how incredibly precise our body's energy budget is. It's this delicate, moment-to-moment balancing act. And understanding what happens when that balance gets thrown off, wow, it just gives you a whole new appreciation for the silent, amazing work your body is doing right now, this very second, just to keep you going.